I've been skeptical of these kinds of sort of lockdowns and forced quarantines. This one would have some relaxation to it. It would allow people to go out for essential services, going to the pharmacy, the grocery store, going for exercise as long as they stay within a certain distance. I think we're now going to see a cascading series of these kinds of actions from cities. Now that San Francisco has taken the action, New York's contemplating it. I don't think they would have put out the notification they did today if they weren't seriously contemplating this and if it wasn't something that was likely to go forward. We're now hitting the steep slope of the curve, of this epidemic curve. There's a growing number of patients on the wards in New York City hospitals right now that are patients under investigation, believed to have coronavirus with their waiting test results on them. So they're seeing a surge in cases inside the city, and I think that's what's prompting this kind of action. We need to find ways to keep people apart. If people aren't going to adhere to the measures that have been put in place, this is really the only place for big city mayors to go. And I think now that some cities have done it, it's going to make it easier for other cities to now step forward and implement these same measures, and maybe even at a federal level.
You said this morning on Squawk Box, we're not seeing a sense of urgency that we need. In what way?
Well, I think we are. I think we're not seeing a sense of urgency across the whole population. I actually am, one of the things that gives me more. I think it's appropriate or reasonable for governors and cities to be reactive and wait until they have some evidence that there's community transmission before they implement the toughest measures. New York City has to be further ahead because it's probably one of the biggest hotspots in the country right now, second maybe to Seattle or San Francisco. But really, all locations should be taking reasonable steps to, implement measures that would induce social distancing, keeping people apart, and things like, closing restaurants, closing bars in places where a lot of people congregate, in cities where you're likely to have some cases. Those are probably reasonable steps to be contemplating at this point.
You suggested that the government should set up a task force, a special task force, to do what?
I think we need to be worried about September. So the epidemic's going to run its course. Probably we're going to see a peak in cases probably late April, maybe early May. Hopefully, if we do the right things now, then the cases are going to start to come down. You're still going to have cases, new cases get reported all through May and into June. July and August, you're likely to see transmission break off. Maybe there'll be some sporadic outbreaks, but come May, you can still see large outbreaks and maybe even another epidemic. And the question is, what are we going to do to help prevent that? What we need in September is a point-of-care diagnostic to give doctors the ability to rapidly diagnose patients at the point of care. You need a therapeutic, and there's opportunities to get a therapeutic in place in time for the fall. And you need a very robust, what we call a sentinel surveillance system. You need to put tools in place so that when people present with influenza-like illness and they test negative for flu, we're testing all across the nation looking for coronavirus so we can spot outbreaks very early. So we need to start thinking about putting in place those elements now so we're not dealing with another epidemic in the fall or the winter.